Hi guys, how we doing? I'm Greg from the YouTube channel Growing Older Gratefully. It's about 12:45, 12:50 Central Time here in Fort Walton Beach, Florida. And actually today I wanted to do my video a little bit earlier than I have since I started this video blog. I just got back from my first physical therapy session. Things went well, but that's why I figured I want to do this video a little bit earlier because I can already feel a lot of the soreness kicking in. So I definitely want to get myself back in bed and relax a little bit. But like I said, today was first session with therapy. I was, quite honestly, I was very nervous about it. I didn't think I would be, but I was starting from about last night. Just wondering how my body was going to react to things. I know since surgery on Friday, I've been doing a little bit of things at home, a little bit of stretching, kind of doing a little bit of the onset of what they want you to start with, the stretching part, before I actually went to the therapy. But like I said, today I was kind of nervous. I will say this: I was telling you last night, it's where I'm going for therapy, about 10 minutes away from where I live, which is fantastic. It's actually the same building where my orthopedic surgeon was, the surgical center, and then that was first floor, then third floor, and then the orthopedic rehabilitation is on the second floor. So it's kind of nice, all things right there for me. Day one with therapy, I will say this, staffing, I've yet to be disappointed with the orthopedic part of any of this so far. My therapist, she's fantastic. This woman, Hannah, seems very knowledgeable, good sense of humor. And I will say this, she worked me pretty darn hard for an hour. From what she had said, I was looking pretty good. I was going through the exercises pretty well. She said, of course, expect to be sore because at time one. So what's going to happen is this first week, today's Tuesday, so I'm going to have a second follow-up appointment this week on Thursday. And then it's going to be thereafter for the next couple of weeks, Monday and Friday. And I'll do the third portion of it, which will be Wednesday, at home by myself. So I'm looking forward to that because one thing I will say is what I discovered even with this therapy, with my insurance, and I'm not complaining. Like I said, with life, the way life comes at you, you got to be grateful for any and all things that are going on around you. So I am as grateful as possible. But one thing I discovered even with the therapy, with me having a high deductible, and then I also have a high copay. So talking to the therapist, she's like, you know what, Greg, I think 2 days a week are going to be fine. The third day, you'll be fine doing it at home. She said, I hate to have you put that much out up front for a copay. So I appreciated that. Now, as far as day 5 post-surgery, today slept very well last night. Now, one thing I did do, because last night I was kind of stirring around a little bit in bed, and I thought, you know what, it's been a couple days, and I have researched on the internet possibly sleeping on my side. So I thought, let's give that a chance, because really, like I said, I'm probably more of a side sleeper than on my back or stomach. So anyway, what I did is, now one thing I will say, and I'm going to have to research it further, is my research kind of came up conflicting. So I had a couple of articles that said, when you're sleeping on your side, sleep on the surgical side. Then I went to another site, and this therapist was saying, no, it's better to sleep on the non-surgical side. But the key either way is you're always supposed to have, pillows between your legs, because you definitely don't want them crossing. That's where you're taking a chance where That's where potential injury is going to come from, of crossing your legs. So what I chose to do, since I wasn't quite sure, surgical, non-surgical, I thought, well, to me, logic would kind of say, do the non-surgical side to sleep on, because then this way there's no weight bearing on a new incision, my new hip, and so forth. So what I did discover is that actually I didn't sleep too much on my side. I did enjoy the fact that I was able to do it. So I will say that that was a positive. Going into today, right now, I'm not sure what I'm going to do later. I realize I'm going to be very sore. Today was just my medication with, my aspirin to help eliminate possible blood clots, the antibiotics. I took my ibuprofen and Tylenol before my therapy because, like I said, I knew I was going to be pushed a little bit, and I wanted to get a little bit ahead of the game. So I'm not sure what I'm going to do later on, whether I may break down and maybe do some of the harder medication for pain, but we'll see. Like I said, I think once I relax, because one thing I did notice when I got there, the therapist was like, my vitals were up pretty good, but she said, that's normal. And I said, oh yeah, because I said, quite frankly, I said, I come in, I'm not really, I'm afraid exactly how this is going to go. I thought it may not be that difficult, but then when you get there and you're not quite sure exactly what they're going to do with you. So my vitals were, my blood pressure and so forth was a little bit higher starting out, so I relaxed. But like I said, moving forward, I'm going to have my therapist is going to be Hannah for the most part. Like I said, seems very knowledgeable, very nice person. Quite frankly, seems like she cares. I've seen her interacting with some different people in there doing therapy, and she seems like a wonderful therapist. So like I said, it's about noon here in Florida. I'm going to try and get some rest. And I think what's going to happen too, I was afraid. I did want to mention this. I did take my stairs because I've been on the second floor, since my surgery on Friday. I did take them steps, and I will tell you what, I did fine. I babied myself going down them steps. I babied myself coming now back up to my room. I was a little bit worried about that, but it seemed like when I jumped online to see how therapists were saying you should take steps down and up, I did that. Things seemed to work very well for me on that. So that was another thing, I guess, getting off of my list was my fear after a few days. Like, I've got to tackle those stairs because now moving forward, not that I plan on continuously doing stairs for a while, but I am going to have to do them. And even if I don't hit the stairs today or tomorrow, I got another physical therapy appointment Thursday. So what I was going to say, guys, is haven't had a chance to look and see if I've had any comments from yesterday or not. I will take a look at things. Definitely, I want as you're taking a look at my video, please interact with me. And any questions and any suggestions that you have, throw them at me. I'm all ears. The other thing is to let me know your experiences, or a family member, any other loved one, let me know. Like I said, I appreciate all that. I want to let you guys know, too, that keep in mind, if you're watching this video, we'd love to have you on my wife and I, we'd love to have you on our Facebook page for Growing Older Gratefully. Like I said, please join us. Like I said, the more the merrier, as they say. But I think what I'm going to do is I'm going to end this video. Like I said, I'm kind of nervous about today's appointment. I did toss and turn a little bit, not from the pain and discomfort, really just for the anxiety of my first physical therapy appointment. So honestly, guys, I am pretty sore. I feel pretty tired. So I'm going to get some rest. And like I said, I appreciate, like I said, for me, this video blog has been a very good idea. I think it's given me the opportunity to kind of vent what's going on with me as my day-to-day of me trying to recover from my left hip replacement surgery, and actually getting myself ready, because I was talking to the therapist and she was a little surprised. And I said, yeah, I said, tentatively, I've got to follow up with my doctor October 27th, and we're looking to do the right hip, the second hip, mid-November. Now, maybe it might get pushed back to late November, but obviously I'm hoping things stay the course, and that I can get that done by the end of the year. Because like I said, in that regard, if I'm able to, it's going to help me immensely with my insurance, because obviously I've already exhausted then all my deductibles, things like that. And like I said, I paid a pretty good penny, because I've had a high copay insurance this year, and I've had a high deductible. In hindsight, I didn't realize that it was something that I was going to, I didn't realize I was going to have some kind of surgery this year. So I pretty much just got the normal insurance I would have, whereas me occasionally going to the doctor here and there. I didn't realize it was going to be something where it was a surgical procedure. And then in this case, ended up being, hopefully will end up being two, but that'll kind of offset and lessen the blow, where then the second one really won't be so much on my pocket, and it'll all even out. One thing I am going to say is, remember what my theme is, and it's going to always be moving forward, is when it comes to your post surgeries, you got to respect the process of the recovery. You definitely have to respect it. So my theory is respect the process, but then hopefully try to enjoy yourself with the recovery itself. There's a lot to be nervous about, but quite frankly, there's a lot to look forward. One thing I will say, when I was talking to kind of getting started with the therapist, she said, "Well, Greg, what are your goals?" And I said, "Well, I'm trying to be realistic. I know I have race buddies that say you're going to be as good as new. You've heard me mention this before, as good as new. You got one bionic hip, you're soon to have a second one. You're going to be stronger, faster. The $1 million, the $1 million, the bionic man type deal. You're going to be stronger, better than ever." I told the therapist, as I've told my wife and friends and family, I'm just going to be grateful that I can actually, once I'm able to move and walk normal again. So anything beyond that is going to be a bonus. So if I'm able to obviously get back to my workouts, great. If I'm able to start race walking again, great. If that means back at the same level I was prior to the surgery and then surgeries, great. If I'm not, I'm one that a body in motion stays in motion. So I do believe that I'm not going to be sedentary. I am going to do any and all things that I can, because I'd like to keep my cardio where in a sense, my vitals and everything are younger than the 59 years of age that I am. So I don't want to regress. I want to get back to what I used to be somewhat. And if I'm able to fully get back to or even better, then great. If I'm not, whatever that means. So with that, I'm going to cut this video short. I want to thank anybody who's watching this. Please share some stories with me. Leave me a comment. Join our Facebook, please. Like I said, it's the Facebook's growing older gratefully. And I will talk at you guys tomorrow. Have a good rest of the day. Thank you.